chers délégués, je vous souhaite...
Distinguished delegates, I would like to welcome you back to the debate. I propose that we continue before moving on to the next agenda item. I'd like to inform you that Azerbaijan has requested a right of reply, which they will be granted at the end of today's session. So we will now move on to the next agenda item, strengthening health emergency preparedness, response and resilience, learning the lessons and building back better. For this agenda item, we have various documents. There is a list of the relevant documents on the screen. And for this session, we will be focusing on the different multiple health emergencies that unfortunately are still affecting our region: the COVID-19 pandemic, monkeypox, as well as the health situation in Ukraine and the region. I would also like to mention at the start of our discussions on this topic that at a global level we also have discussions taking place on the reform of the international architecture of preparedness and response to emergency situations, including the process of the INB. I'm honored to welcome Dr. Roland Dries, who is co-president of the INB, as well as online the Dr. Precious Matsosov from Africa, who co-chairs this process. So I will start by addressing the Secretariat. I know that our regional director is very closely involved here, and I will first give the floor to Dr. Gerald Rockenschaub, who will provide us with some updates on the current situation. You have the floor.
Thank you very much, Nora. If I could please ask if the slides could be pulled up so I could provide a brief technical update on the ongoing emergencies affecting the WHO European region. Maybe at the start, Excellencies, honorable delegates, Madam President, let me say it's really a privilege that I have this opportunity to give you an update on the current emergencies, and allow me to start with a global perspective to just underline the unprecedented level of humanitarian crisis that we are facing at the moment. We have globally 310 million in need of humanitarian aid. WHO supports the response to 47 graded emergencies at the moment across all WHO regions. We have 8 acute grade 3 emergencies. 3 of those grade 3 emergencies, as per our internal emergency response framework, are grade 3 acute emergencies, which is the highest level of severity, and 3 of them are affecting our region: the Ukraine health emergency, the COVID-19 pandemic, and monkeypox. Let me start with an update and overview on the health emergency, the humanitarian health emergency in Ukraine, triggering mass displacement and massive humanitarian suffering. Some facts and figures: 11.9 million people had to cross borders to flee the violence. We have 7 million refugees across Europe, 6.9 million displaced internally in Ukraine, over 13,900 civilian casualties, and more than 5,700 civilian deaths. These figures are likely gross underestimates, and each and every one of them has a personal history and a fate behind them. WHO has recorded 516 attacks on healthcare through our global WHO surveillance system on attacks on health, with substantive infrastructure destruction and health facility damage. The priority public health concerns remain trauma and injury management, maternal and child health, the management of non-communicable diseases, the risk of infectious diseases, massive mental health and psychosocial support needs, protection concerns with human trafficking and gender-based violence, and the health risks around technological hazards. Going into the cold winter season, and the regional director has highlighted that in his speech yesterday, winterization is a main concern, with compromised access to health services through service disruption, compounded by supply gaps in medicines for chronic conditions. Low vaccination rates in children, overcrowding, drinking water disruption increase the risk of outbreaks, and the accidental and deliberate damage of nuclear installations and chemical storages pose substantial health risks. We as WHO are decentralizing our operational footprint across Ukraine, with 7 operational hubs, 4 of them being prioritized, along with staff safety and security measures in this security-compromised, high-risk environment, requiring us to operate under special security and safety arrangements with armored vehicles, personal protective equipment, to ensure staff safety and security, which is a key priority. WHO is working closely and synchronized with our humanitarian partners, with the Office for the Coordination of Humanitarian Affairs, with the Humanitarian Coordinator, aligned with the Ministry of Health priorities, and with oblast and municipal health authorities to respond to the local priority health needs. Access in some areas, in particular in the non-governmental controlled areas in the east, in the temporary occupied areas and territories, and in the hard-to-reach areas along the contact line, remains a main concern. We use every opportunity, joint UN convoys working through partners, to deliver essential supplies to those most vulnerable in those areas. And we count on the progress, and our regional director is personally involved in that, on ongoing high-level negotiations and efforts to expand and open access to those vulnerable groups. WHO, through our country offices and the WHO coordinated refugee health extension in Krakow in Poland, works with refugee receiving and hosting countries. And in Krakow, we work very closely with ECDC, with UN partners and with NGOs, and help countries in refugee hosting and receiving countries to address the health challenges of Ukrainians who had to flee their country, including support for patient referrals abroad and repatriation, Medivac, obviously in very close coordination with the EU, who is providing massive support in that respect to Ukrainian patients. Overwhelmed health systems struggle with the extra burden of this unprecedented influx of refugees, overstretching the health systems, which are already struggling with the backlog through the more than 2 years of the pandemic. Mental health and psychosocial support needs are huge, and gender-based violence a big concern. WHO is therefore prioritizing prevention of sexual exploitation and abuse, and we have mobilized experts to support member states and partners to establish robust prevention mechanisms and systems. We work through and with our partners and as health cluster lead agency within the overall humanitarian architecture. WHO coordinates the work of some 150 plus health cluster partners, national, international, NGOs, civil society, UN agencies. We are working also with and through emergency medical teams, and our emergency medical team coordination cell is coordinating 22 operational EMTs engaged in service provision, capacity building, and patient transfer. And we deployed 22 specialists mobilized through the Global Outbreak Alert and Response Network. I would like to use the opportunity also on behalf of our regional director to say a big thank you to all our donors. Without the generous support, we would not be able to deliver and support life-saving interventions. Let me briefly turn to the COVID-19 situation in the region. I know many of us don't want to hear the message that this is not over yet. 250 million cases are a painful reminder, and even more so the 2 million deaths in the region, that we need to keep our alert levels high. 17 million persons estimated to have post-COVID conditions over the last 2 years require dedicated services. And we still need to enhance our efforts to vaccinate, prioritizing vulnerable groups. We have jointly and in close consultation with the ECDC issued strategy considerations for SARS-CoV-2 and other respiratory viruses during the coming autumn and winter. And thanks very much, ECDC, for the close collaboration on all three emergencies, particularly on COVID and monkeypox. We are concerned that we might see again an overwhelming of health systems due to potential surges and potential coinciding with influenza virus infections. We need to maintain surveillance levels to detect new variants of concern, and we need to optimize public health resources with a continued focus on protecting vulnerable groups and their settings. Let me just briefly turn to the monkeypox situation. More than 23,200 confirmed cases in the region constitute 43% of the global cases this year. 98% of the reported cases are in male, most of them in men who have sex with men. And while most of the cases are mild, 6% require hospitalization and 1% intensive care unit treatment. With the recent stabilization and decline of case numbers, elimination, while challenging, we believe is feasible if we consolidate our collective efforts around this. Our main game is to control human-to-human transmission with the ultimate goal to achieve and sustain elimination in the region. Let me in that context also refer to our policy briefs that we have issued with further recommendations. All these three crises underlined that we have substantial preparedness gaps in the region, so we would, under the leadership of our regional director, propose to move towards Preparedness 2.0. We clearly need a renewed focus on preparedness and readiness in our region, as our action plan to strengthen health security expires by the end of 2023. We need to ensure that lessons are learned, but also that lessons learned get lessons applied. So we propose a complementary regional consultation process in close alignment with the ongoing global processes, supported by a regional technical advisory group to consolidate new lessons learned from the Ukraine emergency, from the monkeypox situation, integrating the COVID lessons learned in full alignment with global processes. In fact, we would plan to design this as a complementary platform to condense regional contribution towards the global processes, the INB negotiations, the working group on targeted amendments for the IHR, the discussion on the global health architecture for health emergency preparedness, response and resilience, while building consensus and distilling regional priorities to be submitted to the next regional committee for consideration. We need an all hazards perspective and a One Health approach underpinned by pan-European efforts like a pan-European network for disease control. Let me put up the last slide outlining our collective roadmap to strengthen global health security. What we need is a strong regional health architecture in support of the global health architecture, and we have strong players and stakeholders on board. And here on the podium we have HERA, we have the ECDC, and we have the global INB process. I think we need to collectively move towards a safer world, and we are strongly committed to support the European member states' engagement in all these processes and ensure a strong coordination at the regional level. Thank you very much. Toda rabba.
Merci beaucoup.
Thank you very much, Gerald.
Je me tourne maintenant.
So I now address the European Commission, which is a key partner of WHO Europe, to share their thoughts on this point, and I have the honor to pass the floor to Mr. Pierre Delceau, the director. You have the floor.
Merci beaucoup, Madame la Présidente.
Thank you very much, Chair.
Ladies and gentlemen, good afternoon. First of all, I would like to thank my friend Hans for having invited me to this very important meeting. I'm very pleased to be here with all of you. But Hans, I must confess something. You gave such a brilliant speech yesterday that really, I don't know what I'm going to do today. I will do my best, but I'm sure it will not be as brilliant as what you did yesterday. So, if you allow me, I'm not going to dwell into the details and more focusing, trying to have an helicopter view. And as you have heard, we are still in the COVID crisis. But still, we can try to learn the lesson from the COVID crisis and try to be better prepared for the future. So what have we learned from the COVID crisis? First lesson, health issues are fundamental. If you have health problems, we have seen how the economy has been affected, how the world has stopped functioning. So we cannot ignore health issues. Those are extremely important issues. The second element, and we need to be honest with ourselves, we were not ready. We were not prepared for such a crisis. And we have paid the price, all of us, collectively. And then the third element on which I would like maybe to insist, I don't know if you know the theory in physics, when you have a butterfly flying somewhere, it can create a storm, in the other part of the world. I don't know whether it's true for physics, but what I know for health, that if you have a disease starting somewhere, it can be anywhere in the world very quickly. And we cannot ignore this new dimension. So we have a duty, all of us collectively. There will be new health crises. We know that. Look now at the monkeypox. Look at the polio virus, which is, emerging again. We know that there will be new health crises. So all of us collectively, we have a duty. We need to be better prepared for the future. So in the EU, in the European Union, we have created a new authority which is called HERA. And I'm going to make a little bit publicity about it because it's new and probably you don't know about it. But HERA is an authority which has been created within the Commission, and I have the privilege to chair this authority, but working closely with the EU member states, because we cannot function in the field of health without the EU member states, without the member states. And why have we been created? Simply just to try to be ready for the next crisis, all of us collectively. What does it mean? We have decided to focus on a certain number of actions, and I believe this is important for all of you. First of all, we need to build the instruments for early detections of health crises, using also modern technology like artificial intelligence. And we are not alone in doing this. I have my good friend, Andrea Amon, who is sitting with me on this podium, who is involved in this process. But early detection is fundamental. We need to know what's happening somewhere in the world, and we need to be ready to act as fast as possible. Second element, investing in research and innovation. If we talk about the COVID vaccines, they were not invented in 6 months. They are the results of long-term investment in research, leading to the development of those vaccines in a few months' time. But without this investment in research, we would be without the COVID vaccines now. So investing in research and innovation is extremely important. And then the third element is building medical countermeasures, stockpiling, purchasing vaccines, purchasing therapeutics which are needed. Actually, that's what, as HERA, that's what we are still doing now. We continue to monitor, the COVID vaccines, and we are now distributing the adapted COVID vaccines to the EU member states. But I must also tell you, we are also in charge of donating those vaccines to countries outside of the EU, because we also believe it's important to continue to be solidarity with the rest of the world. We have also purchased, for instance, monkeypox vaccines, which are also one part of the solution, not the only solution to the monkeypox crisis, but it is one very important element of the solution. But of course, as I said, talking about the butterfly, we are fully aware that we live in a global world. So ERA has not as a vocation to create Fortress Europe. Our role is not to create Fortress Europe. Our role is to be solidaire with the rest of the world, and especially with the rest of Europe. And of course, in this context, what the WHO region Europe is doing is extremely important. And I can tell you that we support all those initiatives. Because again, we will be able to find the next crisis if we are simply solidaire and if we work in cooperation. So we simply say that what you want to do is extremely important for you, all of us collectively, but also for the European Union individually. So my plea to you is, let's try, all of us collectively, to reflect. And you know, we are humans, so we have always a tendency, we forget crises very easily. Now we have energy crisis, of course we have Ukraine, which has a dimension, but we have a tendency to forget about crises. But if we don't take the measures which are needed now, I can tell you one thing. When there will be a new crisis, because there will be a new health crisis, if we have not taken those measures now, we will not be ready, and the world will suffer again, and many people will die. So we collectively have all a duty to implement actions now and to work as fast as possible. Thank you very much.
Merci beaucoup.
Thank you very much. I now give the floor to Andrea Amann, Director of the European Centre for Disease Prevention and Control.
Thank you, Madam President, dear Regional Director, dear Ministers, dear colleagues. I would like to thank you, dear Hans, for inviting me today to speak about our perspective to the emergency in our region, because we certainly were very much involved. And while we certainly hope that we have seen the worst of the COVID-19 pandemic, the one overarching lesson that we learned is that we always must be prepared for the unexpected. There remain now several different and possible scenarios for COVID-19, and while these risks may be driven by the virus and its variants, the response and the ultimate impact that we face is up to us. So what we need to do is we have to maintain and expand the cornerstones, the vigilance, such as the early warning and surveillance, and the continued efforts to expand the vaccination coverage if it comes to COVID. The response structures built for this pandemic must be maintained and not prematurely dismantled, not only to prepare for the resurgent, but also, as much as possible, to prepare for similar challenges, such as influenza, for instance. So we are committed and actively working to strengthen each of these areas with the WHO, the member states, and the Commission. Now, when we come to monkeypox, the situation is a bit different. Emergency takes or lasts only a bit shorter. Nonetheless, what we have learned is how difficult it can be to contain an outbreak even if the disease agent is known. And the mode of transmission that we see here in Europe, also in America, was not common for monkeypox before, and alerts us that pathogens, if they go to new areas, may find and occupy certain niches that provides them with an opportunity to spread. And in this outbreak, we have also learned that the availability of medical countermeasures alone might at times not be sufficient to control the outbreak. So risk communication and community engagement was and will be the basis of any other response intervention, including vaccinations. Now coming to our work regarding the war in Ukraine, I have been since February 22 in regular meetings with colleagues in the neighboring countries of Ukraine, in with Czechia, Hungary, Poland, Romania, and Slovakia, and also with Moldova. And based on their requests, we have published numerous technical documents and guidance, infographics to support the national authorities and health professionals in their efforts to support the refugees. We have translated all these documents to their national languages and also in Ukrainian. We have also offered support on the ground. 7 experts have been deployed to Poland as part of missions coordinated by DG ECHO, and 4 experts together with WHO to Poland and Romania. And we will certainly continue the support to the EU member states and stand ready to support Ukraine if requested now or in the rebuilding of the health system. Now, when I conclude from all these, what have we learned overall? I think strengthening the surveillance systems using digital solution will be a major task, not only for the emergencies, but also for our routine, as we discussed this lunchtime, for the Sustainable Development Goals related diseases. Then supporting and maintaining and increasing capabilities of public health staff is a priority because just having the machines doesn't help. We need people that are trained, that are willing, and that are there to operate. What we see coming and have seen already in the past 3 years is that the workforce is a very central point, and we have discussed much about healthcare workforce, but public health is even in a worse state. Then we need to establish a dynamic collaboration between public health systems and other sectors, particularly in the One Health perspective, because both for COVID and for monkeypox, we have seen that there are animal reservoirs that spill over to humans. They may go back to the animal reservoir and may come back. So there is a connection that we have to take into account. And lastly, based on the lessons learned from COVID-19 and from monkeypox, improving risk communication and community engagement is vital to make sure that specific communities and also the general population feel part of the control efforts and are seen not only as the passive recipients of orders. In the end, controlling the pandemic is not achieved by one group only, be it decision makers or public health professionals. It requires the contribution of everyone. And we all have to work together, because only if we are prepared together, we are safe together. Thank you.
Merci beaucoup.
Thank you very much. I now give the floor to the co-chair of the INB, Dr. Roland Dries, who will update us on the work of the INB. You have the floor.
Thank you very much, and good afternoon, dear colleagues. It's been said a couple of times already during these past days. COVID is not over. We were not well enough prepared. We need better cooperation, and we need better collective arrangements to act better the next time when such a pandemic might occur. And that is why we collectively, as WHO countries, decided that we should have an INB process in place to look for ways to come up with an instrument that could help us do better next time. And I'm happy that you chose me, and I'm honored that you did, to be the European representative in the so-called bureau of this process. These international negotiation processes often have bureaus in which all the regions are represented, and I am doing that on behalf of you all. And together with my colleague Precious Matsoso from South Africa, I'm chairing that meeting, which is a challenging but also very interesting and honorable task to do. Like I said, whether COVID is over or not, it's not so relevant for the work in the IMB process we have, because it's actually designed to be better prepared for a next pandemic. And it's been also said before on this table as well, it's merely a matter of time, then a question if, that we will be hit again. And we do not know in what way, by what pandemic, or by what pathogen, but that we will be faced with something like this again is almost certain. And we want to do better. And that's why we have this process. We want to work on a new framework for pandemic prevention and response. And that framework exists, or should exist, of the IHR systems as we know it, but improved. As you know, in Geneva, we talk about improving the IHR process. But that's not enough, because the IHR process was never designed for major pandemics. So we need a new instrument which also deals with other elements of a pandemic. And together, these two instruments we will have together should provide us with the right framework to address a pandemic next time. Over lunch, we had a session which a lot of you visited, and then we talked about what have we done, what is the process, next step. So I will not go into that, not to repeat what I've said before, but if you want to know, I'm happy to update you if need be. But most of you are already represented in the process in Geneva as well, so I have not said anything new in that respect. So allow me just to make a few more political remarks maybe in this content instead of going into the details. Firstly, many of you are involved in this process in Geneva for this new instrument, but not all of you. And there could be different reasons why countries are not involved. That could be the fact that you have smaller delegations in Geneva, for example, but the fact that we've now decided that this new instrument could contain legally binding elements makes, at least in my view, that I think that all countries should be involved, at least at a certain level. So if you're not fully involved, try to make sure that you try to be involved as much as you can. Second point I would like to make is that we run the risk of losing the urgency. 2 years ago, there was nothing else we talked about than COVID, and today there's so many other things we talk about and which request our attention. So people might think, and that is a mistake in my view, that this is over and back to business. So let's make sure collectively that we do not lose the urgency, and that we will use the time we have before our next pandemic might strike to come up with better arrangement in place. Thirdly, I think what we need, and some of the colleagues over the last few days have come up to me and said it as well, is that what we need is a positive common narrative on what we are doing and why we are doing it. It might make a lot of sense that you say, yeah, of course we should have it, but I had a conversation with one of you just outside and say, what if we have a new minister? What is the narrative we have explaining to him or her that the things we do are the right things we do? And that's something for me as a bureau member, but I think for all of us to think about, especially also because in the Netherlands, but we've seen it here in the streets as well, there are people who do not believe that we are doing the right things. And from that perspective, maybe those people who are protesting in the streets we will not convince, but a far larger audience who are influenced by them, we should be able to reach by a better narrative than we have today in place, why we are doing this and why this is so much needed. And I think that's something to take home and think about. And the last thing I would like to say, if you have questions, remarks, or anything you would like to speak to me about, please do so, and I'm always available. Thank you very much.
Merci beaucoup, Roland.
Thank you very much, Roland. I think that all of you underscored the importance of learning lessons, reflecting, preparing for the future, and also doing everything together. So I applaud the discussion and I welcome what's going to take place now. So I turn now to member states. Czech Republic first on behalf of the EU. Go ahead.
Madam Chair, distinguished Regional Director, Excellencies, colleagues, I have the honor of speaking on behalf of the European Union and its member states. Our European region is struck by the current 3 public health emergencies of international concern, namely COVID-19, monkeypox, and polio virus, and many other health challenges which we are facing on a daily basis. COVID-19 remains a major threat and concern for our region. Even though the epidemiological situation has improved, we are already in the preparation of a potential wave of infections in late autumn and winter. We thank the regional office for the ongoing support and call upon it to continue its crucial help to countries in this regard. Regarding monkeypox, we are very thankful to the regional office for its clear communication outreach. It is important to raise awareness while preventing stigmatization. The EU is strongly concerned about the polio virus outbreak in our region, namely in Tajikistan and Ukraine. The fact that this virus, which had actually been eradicated in Europe, has reappeared is alarming. This is why comprehensive vaccination, protection, and full immunization of as many children as possible remains of utmost importance. We are deeply concerned about the devastating effects of Russia's unprovoked, unjustifiable, and illegal war of aggression against Ukraine, which grossly violates international law and the UN Charter and undermines international security and stability on the public health within our region and beyond. It has a devastating impact on the Ukrainian health system and its people, and it is leading to restricted or impossible access to life-saving health services for millions of people. The alarming health consequences of Russia's aggression also exacerbate the impact of public health emergencies in the whole region, for example, by disrupting crucial vaccination programs and enabling the spread of infections, including due to food and water shortages. In the midst of these alarming health emergencies, the EU will remain strongly committed to drawing the right lessons from the current COVID-19 pandemic, also in international health law. We remain committed to strengthening the IHR through amendments to supporting the negotiations of a new convention, agreement, or other international instrument on pandemic preparedness and response, as well as to reinforcing a One Health approach. The second meeting of the INB in July marked an important milestone as the member states discussed possible elements of the instrument and agreed that it should be legally binding and contain both legally binding as well as non-legally binding elements. The INB further identified that Article 19 of the WHO Constitution is the preferred provision under which the instrument should be adopted, without prejudice to also considering the suitability of Article 21 and mindful that the decision will be made by the World Health Assembly. We welcome the regional director's proposal to start a consultative process for drafting an updated action plan to improve public health preparedness and response in the WHO European region. It is important that this process is inclusive and comprehensive. Only by making all stakeholders heard can we make sure to implement the lessons learned and bring in the regional perspective. We would also like to stress that the consultations have to be further aligned with ongoing processes to reinforce WHO and the global health architecture and specifically take into account ongoing efforts to strengthen health emergency prevention, preparedness, and response in WHO and beyond, especially in the framework of the INB, the IHR, discussions around the FIF, and the development of a new EU global health strategy. At the same time, we think it should take into account the challenges and gaps that are specific to our region. Thank you.
Merci la Tchéquie.
Thank you very much, Czech Republic. I'm now giving the floor to Luxembourg to be followed by the Russian Federation and then Turkey. Luxembourg, please, go ahead.
Merci, Madame la Présidente.
Thank you very much, Madam Chair.
Luxembourg
shares the views and the reflections that were presented by the Czech Republic's delegation on behalf of the EU and supports the strategic considerations of the WHO Euro region with regard to COVID-19 and other respiratory diseases and infections, which will, of course, have a role to play in the future. This is a document which is a strategic framework and helps member states to prepare in an optimal fashion. We also share the opinion of WHO Euro with regard to the fact that preparation should go beyond just COVID-19 and requires including other respiratory pathogens. In this regard, Luxembourg has an awareness-raising campaign that we're working on to look at the target population to vaccinate for COVID-19 and other things, and also as part of our continuing ongoing program for vaccination for COVID-19. We are focusing on the elderly population, but we're not forgetting, of course, other categories of younger people who might also be vulnerable due to other comorbidities with other diseases. We have a broad oversight of respiratory infections, looking at molecular biology, which allows us to examine any genetic deviation, or which might in its pathogenicity or level of transmission somehow be similar. We will continue to look at the crucial elements of this. We understood over the last few years, and will continue a high-level focus in this area from our side. Luxembourg will have contact tracing, which will remain in place and which could be activated or even enlarged if needed. And we're also ready to roll out very quickly gene tracing and testing. Primary healthcare and hospitals are ready and prepared and have the necessary personnel in order to be able to accelerate antiviral treatments. We have just made available antiretrovirals in local pharmacies, which means that primary medical doctors can prescribe them. Also, we'll look at other respiratory pathogens outside of COVID-19. We would like to actively participate in internal reflections that are taking place in the INB, and we mandated the OECD to have an independent examination of Luxembourg's ability to manage the crisis during COVID-19. We want to be able to really point our finger and get to the heart of the issues to be improved, and that will help us better prepare for future crises, which might come tomorrow. We also welcome the WHO Europe's idea to not just limit itself to reflections to only respiratory infection crises, but also to have a more global, broader approach. For example, AMR, thinking One Health, and also working with the European authorities to control diseases to focus on public understanding of health and how we're going to manage crises in the future. We are convinced that it is by going through all of these different actions together that will allow us to be better prepared for the next crisis at hand. I thank you. Thank you, Luxembourg. I shall now give the floor to the Russian Federation, to be followed by Turkey and then Slovenia. Russian Federation, you have the floor. Distinguished Madam Chair, I thank you for giving me the opportunity to speak today. We would like to actually take the floor a little bit later, if we may, because we'd also like to just state that we will be speaking online on this agenda item. Thank you very much.
Merci, la Fédération.
Thank you very much, Russian Federation.
Est-ce que je comprends que vous avez une intervention en ligne?
Have I understood that you therefore have an online statement?
Да, прошу
Yes,
прощения, у нас
forgive me.
представитель готов зачитать выступление
Actually,
онлайн.
now
Спасибо.
we do have a representative who would be ready to read this statement out remotely online if possible. Thank you. Can you hear me? Says the speaker.
S'il vous plaît, je vous en prie.
Yes, go ahead, sir.
Спасибо, уважаемый.
Thank you very much, Madam Chair. The Russian Federation supports the efforts of the WHO Euro regions to prepare for health emergencies. Russia makes its contribution to preparedness measures and building regional capacity to respond to these crises and pandemics. This very week, the
Epidemiological Service of the Russian Federation is celebrating its 100th anniversary, and throughout the entire Soviet period, our scientists were working with other partners to fight infections, including emergencies and epidemia. Over the last years, we've developed some 25 different labs abroad, and we have the first mobile lab of the 21st century, which was organized together with the WHO, and we created. We have therefore helped millions of people throughout the world. We've provided vaccines, and we have celebrated, as I've said, the 100th anniversary. In November, we had one of our testing centers be formally recognized. The government of Russia supports WHO's programs to implement the IHR, and over the last 6 years, we have made a financial contribution, more than $16 million US. We are carrying out consultation with the WHO member states to create a new strategy to prepare for health emergencies in the Euro region. And of course, we need to have broad participation of all stakeholders through consultations. We need to have a high level of professionalism and, of course, avoid any politicization of the discussion of preparedness. We are prepared to work with the existing processes, for example, the IHR, and to create a general European disease network. We believe that we need additional work and look at how judicious this goal would be, because there are differences in countries' potential and readiness to be able to participate in this. We note the parallel negotiation processes on these issues, and the practical realization of this goal requires time still. We would particularly focus on the issue of the global architecture for health. We believe that the new instrument, which has been developed within the WHO, will be practical and professional in its ability to make recommendations as part of the mandate of the INB. We underscore the fact that it would not be acceptable to have anything that would limit the sovereignty of individual countries or somehow limit the well-being of the health of countries. Of course, this would include some sort of non-voluntary review mechanism or something like this. Publications need to be verified as well. Any approaches of this nature also have to be considered, and this would include any amendments to the IHR. We agree with the One Health approach, and we are prepared, of course, to looking forward to doing everything possible to support this. The Russian Federation also provides humanitarian assistance to Ukraine, for example, through the 4 million refugees that have come to the Russian Federation. We have a number of we are providing thousands of people and refugees with medical and psychological assistance as they flee to our country. Thank you very much for your kind attention.
Merci, la Fédération.
I thank the Russian Federation, and I would just remind everyone to please respect the speaking time of 3 minutes. 3 minutes, please. I shall now give the floor to Kazakhstan, who will be followed by Malta, and then Israel. Kazakhstan, you have the floor, please.
Je passe
I
au délégué suivant,
will skip to the next delegate, and then I'll come back to you. So Malta, please.
Thank you, Chair. Malta aligns itself with the statement made by the Czech Republic on behalf of the EU and its member states. This intervention will focus on the important topic, public health challenge of AMR, a key component of any revised strategy or action plan, and the way forward on emergency preparedness and response. Malta thanks the Secretariat and takes note of the information document on the development of a new European regional roadmap for the implementation on the 2015 Global Action Plan on AMR, applying the One Health approach to be presented to the 73rd session of the RC this time next year. We welcome and fully support the development of the roadmap and look forward to the consultation process as outlined in the document. The AMR crisis reaches far and wide, spanning sectors and policy areas within and across human health and healthcare, agriculture, animal health, environment, climate, and finance. The cross-cutting nature of the AMR challenge must be reflected in the extent and depth of stakeholder involvement in this process. It is of utmost importance that AMR stays high on our political agendas and that all stakeholders are engaged throughout the process, including pharma, academia, the media, general public. Clearly, we should not reinvent the wheel and learn from the wealth of experience that we have gathered over the years, maintaining a high level of surveillance data and the inclusion of key performance indicators are critical drivers of success. COVID-19, which has challenged our health systems and continues to do so, has also resulted in deterioration of the AMR situation in many hospitals through deflection of resources and aggravating factors relating to the management of patients with COVID-19. And this has already been documented in the literature. Against the backdrop of our fast-changing and demanding realities, the experience of COVID-19 has only served to highlight the importance of solidarity and unity in working collaboratively through the process of recovery from the pandemic, as well as in strengthening our health systems and preparing for future pandemics. This is also a key opportunity to harness the experiences and resources of the EU and other member states in addressing the AMR challenge and the One Health approach adopted through various initiatives, tools, and guidance documents from ECDC and WHO. Cross-regional examples and lessons learned may be adapted both ways to regional and national contexts. As we prepare to build a vision for the United Nations General Assembly high-level meeting on IMR in 2024, Malta, also through political involvement in the quadripartite One Health Global Leaders Group, remains committed to working to keep AMR high on the political agenda towards sustainable solutions to ensure that antibiotics are no longer an endangered class. Thank you.
Merci, Mal.
Thank you very much, Malta. I shall now give the floor to Israel, to be followed by Greece and Finland. Israel, please.
Israel embraces the WHO's priorities and principles for emergency health preparedness, response, and resilience. In fact, these priorities have been integrated into Israel's emergency preparedness model for many years. This model is generic and highly adaptable. Israel's healthcare system is on constant alert for the 10 different emergency scenarios ranging from natural disasters to man-made disasters, conventional and non-conventional terrorism, and large-scale conflicts. For each and every scenario, Israel has its model ready, containing infrastructure, equipment, doctrine, and SOPs, training, and drills. Included in this model is planning for surge capacity in cases of emergency or conflict. This model rests on precisely the same whole-of-society approach as advocated by the WHO. In emergencies, Israel aspires for universal health coverage and continuity of care for all elements of society, not just directly affected parties. On a similar note, in times of emergencies, all medical institutions and relevant facilities are defined as national resources falling under the central command and control of the Supreme Health Authority. Israel's model in times of conflict has been tried and tested with lessons learned and applied after each incident. Consequently, Israel has much to contribute to efforts around the world. In the wake of the COVID-19 pandemic, Israel has, of course, also had the opportunity to identify gaps and sharpen its responses. Among the main takeaways from the pandemic has been the importance of intelligence and data. Israel's Health Intelligence Division was essential in conducting early detection and surveillance. The ability to gather and analyze real-time data proved crucial in rapid response and quick decision-making. International collaboration and information sharing is critical to ensuring containment of outbreaks. Real-time data is essential not only for pandemics, but for other emergencies as well. And early detection of these emergencies is needed for a rapid response. It is upon us all to ensure that the WHO is able to declare emergencies in a timely manner to enable quick action to prevent or contain major crises. Israel sees great benefit in promoting and standardization of principles in which countries can both identify shortcomings in their preparedness and learn from each other's best practices. Israel supports multilateral and bilateral efforts to share experience, knowledge, and best practices regarding emergency preparedness and response, and stands ready to contribute in any way we can to WHO efforts in this important field. Thank you.
Merci Israël.
Thank you very much, Israel. I shall now give the floor to Greece, to be followed by Finland, and then Georgia. Greece, please.
Hi, good afternoon. We're talking about preparedness, and there are many types of threats in health system. The pandemic was one, and it took us all unprepared. We were unprepared, but also war is a threat. Many other possibilities, and then things like the energy crisis may lead to mental health problems. So crises come in many different shapes. On the other hand, we do have tools. So we have public health measures, Dr. Hammond said, like social distancing, for example, in pandemics, vaccination, of course. We can do planning ahead, which many countries have done, and we need versatile systems. And by that, we mean hospitals that can have facilities that can turn into ICUs, but we also need versatile health workers to be able to respond to such crises. So although hopefully we will not face similar crises very soon again, the possibilities are always there. The personnel may not always be in the ICU or in public health, but we need people who can step into ICU or who can step into public health and help in times of crisis. So this is something that we probably need to change, the way we educate our healthcare workers, medics, nurses, everybody involved, into being able to quickly adapt into a new situation. And the same goes for hospitals. But there are other threats I think we should also consider. Mentality is one. Information and fake news is another. We've had huge vaccination campaigns, for example, across the globe, but we also have a very important anti-vaccination movement, which we should all move forward and sort of combat. So how we train people, how we make them understand information and think about this information and come back with the right response to that information is also very important. So versatility, I think, has to do with education, with the planning and the last thing that is always very important is collaboration. The reason why we managed to cope with the pandemic fairly quickly is because people work together, scientists, doctors, everyone, to be able to arrive at vaccines pretty early. We have good technology, so we do have the power to turn things towards the way we want them to be. But for that, we need to work together, and the WHO is very important in this, as is the CDC, the ECDC, and all the organizations, and each and every one of us who can work. So I think we really need the mindset, the collaboration, and also the information. Thank you.
Merci, la
Thank you very much, Greece. I shall now give the floor to Finland, to be followed by Georgia, and then Monaco. Finland, please.
Madam President, distinguished delegates, first of all, I would like to express our gratitude to the World Health Organization to supporting Georgia's capacity building during COVID-19 pandemic, which enabled our country to make significant progress towards building sustainable public health emergency response mechanisms. COVID-19 pandemic showed us that health systems should be able to ensure uninterrupted delivery of essential health services and at the same time be prepared to respond to emergencies. Over the last 2 years, Georgia has intensified emergency preparedness efforts at all levels. Multidisciplinary, whole of government and whole of society approach, coupled with health system strengthening efforts, proved its effectiveness in addressing complex challenges related to the pandemic. The law of public health of Georgia enables successful implementation of the international health regulations. Existing public health infrastructure is well equipped with relevant tools for interagency, intersectoral, and international collaboration. The integrated surveillance system and well-established laboratory network are important pillars of public health security system. The Public Health Emergency Operations Center, which has been operational at the National Center for Disease Control and Public Health since 2017, plays an important role in emergency preparedness and response. The center should be maintained and strengthened for adequate readiness in upcoming emergencies. Given the current crisis in the region, we believe that regional collaboration for promoting the health security agenda is more important than ever. We appreciate the opportunity of being part of regional initiatives on emergency preparedness and response and welcome interventions aimed at experience sharing and capacity building. We would like to reaffirm our long-lasting commitment to strengthen required capabilities to rapidly detect, verify, and notify new and evolving health threats and to effectively respond to public health emergencies caused by any hazard, and actively participate in all aspects of regional consultations to develop broad consensus on the future regional priorities for a new strategy. Finally, I would like to thank all our partners and collaborators for their contributions made toward our country's public health system. No doubt that joint efforts will give us better opportunity to strengthen our capacities to detect, respond, and prevent new global health challenges. I thank you, Chair.
Merci, la Géorgie.
Thank you, Georgia. And it's the delegate of Georgia who has just spoken, so we are now coming back to Finland. Finland has the floor.
Honourable Chair, finalise herself with the statement delivered on behalf of the EU and its member states. Finland is committed in the global preparedness processes and strengthening health emergency preparedness and response, including through strengthening of the legal framework. At the same time, we need to implement lessons from the pandemic at country level. We need strong and resilient health system. Gender perspective has to be integrated in our efforts for preparedness, resilience, and recovery. We must address inequalities and safeguard public trust to achieve more equal, inclusive, and resilient societies. Finland considers the work of Pan-European Commission on Health and Sustainable Development, of which Finland's former President Tarja Halonen acted as one of the commissioners, important and timely. We, in particular, appreciated the comprehensive approach to health and well-being, societal resilience, and sustainable development of the Commission's report and recommendations. Investment in health and well-being benefit the whole of society and enhance sustainable economic, social, and environmental development. We are interested to learn about the next step in the four-selected stream of work. The topics are important. We would like to better understand the process, expected engagement of member states, as well as alignment with the global process and the European Action Plan. Finland looks forward to further exploring the recommendations in preparation to a safer and more equitable world. Thank you so much.
Merci, la Finlande.
Thank you, Finland. I now give the floor to Monaco, who will be intervening remotely.
Je vous remercie, Madame la Présidente.
Thank you, Chair. Thank you, Nora. I will be focusing essentially on the document ERC/72/8.
La Principauté de Monaco remercie le secrétariat pour le rapport présenté.
Monaco would like to thank the Secretariat for the statement. I can hear a sound in the background. Perhaps it is the interpreters. We fully share the observations contained in these documents with the various crises that our region is currently living through, as well as the increasingly felt impacts of climate change, which will have an impact on health services and health personnel. The proposed path for the European region of preparing a new strategy for preparedness and response seems very relevant. Certain processes are currently underway on the global level to collectively strengthen the resilience of our society and health systems. As a result, it is absolutely necessary, and this was highlighted in the debate earlier, that the European response should coordinate with this work, but also with the permanent missions in Geneva and we should participate in the various intergovernmental processes that are ongoing. We would like to have some more information on the plans of the regional director, in particular on the aims, the deadlines, and also in particular what is planned for the next regional committee. And finally, if we could have some more detailed information on the coordination and how this will be coordinated with the process on the global level. Thank you. Thank you, Monaco. I now give the floor to Turkey, to be followed by Portugal and Switzerland. Turkey, I think you also wanted to speak online.
Yes, thank you, Chair. Disease outbreaks, disasters, and humanitarian crises lead not only multi-sectoral, but also cross-regional catastrophic public health risks and consequences. Without any doubt, responsibility to be better prepared for health emergencies starts at national level and spreads across both regional and global level. At this point, more responsibility inevitably falls on WHO to build and sustain resilient national and regional capacities required to keep the region and the world safe from epidemics, other health emergencies, as adopted in the EPW13. We would like to express our appreciation with the starting steps for development of a strategy to strengthen health emergency preparedness, response, and resilience in the region. Having learned lessons during the COVID-19 pandemic, which has not actually ended yet, our mission is now the right question of how we want to be remembered in the future by our next generations. WHO Europe, cognizant of this responsibility, established Pan-European Commission to address escalating pandemic hazards as early as August 2020. And we, as a country, having participated in the Pan-European Commission's meetings and contributed to discussions, attach great importance in operationalization of the Commission's policy recommendations. We appreciate WHO Euro's commitment to those policy recommendations with the aim of improving the resilience of health and social care in the region. We welcome the establishment of a pan-European network for disease control, but we hope it will not lead to any duplications among existing structures such as ECDC together with other networks. A network of networks needs to encompass of the whole region, thereby complementing existing structures' limited memberships. Only with this encompassing nature, the network to be established will contribute to development of a pan-European architecture for health emergency preparedness, response, and resilience. Regarding the policy recommendation of ensuring equitable access to vaccines and medical countermeasures across the region, we would like to see the initial steps without any delay for key issues, namely waiving intellectual property rights, establishing the relevant regional governance mechanisms, and ensuring vaccine sharing policies. Turkey, as a country affected not only by health emergencies, but also humanitarian crises in and around the region, will continue to work in collaboration with WHO constructively in the near future, including INB and IHR amendment processes to take the global preparedness a step forward. Thank you.
Merci la Turquie. Je donne
Thank
maintenant
you,
la parole
Turkey.
au Portugal qui sera
I now
suivi
give
de
the
la
floor
Suisse
to
et ensuite
Portugal,
de la Norvège.
to
Le
be followed
Portugal
by
vous avez la
Switzerland and Norway.
Merci,
Portugal, you have the floor.
Dear Regional Director, Mr. President of the Regional Committee, distinguished colleagues, Portugal aligns itself with a statement previously made by the Czech on behalf of the EU and its member states. The past years have shown that health emergencies appear unexpectedly and force upon us major challenges. Adding to the pandemic, just 2 months ago, global monkeypox outbreak with considerable impact in Europe was also declared a public health emergency of international concern. This reflects the world we are living in, dealing with succeeding emergencies without time to properly prepare and recover in between, climate impacts and heat waves, natural disasters, social and migration crises, epidemics. We now live in a world of emergencies, and this calls for an all-hazards approach capable of tackling these convergence of risks that, regardless of nature, drive significant demands on health systems. We thank the work of WHO Regional Office of Europe and the support given to currently ongoing emergencies. Chair, an important part of health emergency preparedness and readiness relies on the international health regulations core capacities. and the awareness brought by the pandemic, the gaps felt on the implementation of IHR, and the crucial role of solidarity between countries to keep the world safe, makes this the perfect moment to implement a peer review mechanism on the global core capacities and essential public health functions. Portugal, amongst other member states, have been closely working with WHO Headquarters Secretariat on the Universal Health and Preparedness Review. As the UHPR should be adapted to country and region contexts, the regional office can play an important lead role. We expect to see this mechanism included in the new strategy and action plan for resilience against health emergencies in the WHO European region, Preparedness 2.0, and looking forward for the regional consultative process with member states. It is evident that now more than ever, the fast-changing context of global public health requires a governance model founded in solidarity and determination, where WHO Europe must play a pivotal role to reinforce capacities and capabilities in preparedness and response within the region. Thank you.
Merci, le Portugal.
Thank you, Portugal. We now give the floor to Switzerland, to be followed by Norway and Germany. Switzerland, you have the floor.
Sehr geehrte Frau Vorsitzende,
Madam Chair,
die Schweiz möchte zu den
Switzerland would like to make a few comments and proposals on the documents under this agenda item. In particular, since these have not yet been discussed in detail in the Standing Committee, we would like to propose that these documents be passed over to the SCRC for the coming session so that the necessary in-depth discussion could take place. Firstly, the working document number 8, with a proposal for renewing the regional strategy for Preparedness 2.0, seems currently to be premature. There's ongoing work on the global level, such as in the INB in this area. We need to avoid duplication or get ahead of the global approach on a regional level. As a result, we could consider a prolongation of the current plan of action. Secondly, concerning the proposals that are contained in Information Documents 6E, the proposals of the Regional Director on strengthening the global architecture for preparedness, response and resilience in health emergencies, as well as the ongoing work of the Monti Commission with information contained in Information Document 1, we are concerned that these will be passed on to the Standing Committee without further discussion within the Regional Committee. A discussion on the individual lines of work seems necessary to us, and we rely on the preparation of the SCRC. On this basis, we could have, as a second step, an extraordinary session of the SCRC that is open for all member states for a further consultation on these documents. We would be very grateful to the Secretariat if they could consider this approach. Thank you. Thank you, Switzerland. I now give the floor to Norway, to be followed by Germany and Belgium. Norway, you have the floor.
Regional Director, colleagues, we are grateful for the information provided on the work of the Regional Office in countering the 3 ongoing public health emergency of international concern declared crisis. We request that the Regional Office continue to keep Member States apprised of this work in this regard. Concerning the proposal to establish a process to renew the Regional Action Plan on Health Preparedness, we take note of the proposal to start this process already this fall. However, we believe global processes should be taken into account to a larger extent. We believe significant attention will have to be devoted to implementing the pandemic treaty and the revised IHRs once ongoing negotiations are completed in 2024. The Regional Office will need to devote significant attention and capacity to supporting implementation of the outcome of the global agreements at country level. We therefore propose to await the outcomes of those processes before assessing the need for a new separate regional plan. Regarding the follow-up of the Pan-European Commission on Health and Sustainable Development, we find it positive that the proposed follow-up would put One Health and investments in health on the European agenda. Advocating for safeguarding health budgets and displaying evidence on sound investments in health are key tasks for the regional office. However, we believe the current proposals, especially the proposal to establish a governance mechanism for equitable access to countermeasurements in the region, need to be discussed in greater depth before the committee lends its support. Thank you.
Merci.
Thank you, Norway. I now give the floor to Germany, to be followed by Belgium and Spain. Germany, you have the floor.
Germany fully aligns with the EU statement delivered by the Czech Republic. We welcome the development of a new regional strategy to strengthen health emergency preparedness, response and resilience. Obviously, we've heard Switzerland and Norway just now loud and clear, and I guess we share many of the concerns and issues that were raised by Switzerland and Norway. For us, it's of utmost importance to be in line with the global processes that have been mentioned, so the INB process, the negotiations for a new pandemic treaty, the strengthening and amendments of the IHR, as well as to ensure proper financing for preparedness. And we need to make sure that obviously what we are doing on the regional level is well in line with the global proceedings. From a German point of view, I'd like to stress 2 points. First, let us make best use of the great advantages that we have in the European Union to build on strong EU institutions with the EU Commission, ECDC and HERA. And it's a good signal that Andrea Amon is sitting on the stage here when we are discussing this issue. We pose ourselves the question, how can we make best use and ensure that the EU institutions cooperate well with the Euro setting and on a pan-European scale? How can we avoid duplication of work while recognizing, obviously, that the group of Euro member states is different to the group of ECD members? And I guess that's obviously a given challenge. Second, we believe we must focus on and operationalize core lessons learned and actions. For Germany, that means that we have prioritized within the G7 Pact for Pandemic Readiness the areas of collaborative surveillance and the strengthening of a public health emergency workforce for better predictable rapid response. By doing so, we want to build on all the existing initiatives and see how G7 can best contribute to align and to maximize impact. The past has provided increasing experience and evidence that investing in education, training, and know-how of people who can detect and assess health outbreaks, analyze the data, as well as raise the alarm if necessary, that all this needs to be a priority. We also deem it important that measures against AMR are duly considered in our collaborative actions. Therefore, we support the development of a regional roadmap on AMR, since the COVID-19 pandemic has demonstrated that the misuse of antibiotics has further aggravated the threat of antimicrobial resistance in the WHO region. We call for an integrated approach to tackle the silent pandemic of AMR, hence to do justice to a unified One Health action, strengthening the quadripartite. Thanks a lot.
Merci l'Allemagne.
Thank you, Germany. I now give the floor to Belgium. It will be followed by Spain, then Ukraine. Belgium, you have the floor.
Thank you, Madam Chair, Mr. Regional Director, dear colleagues. Belgium fully aligns itself with the statement delivered by the Czech Republic on behalf of the EU and its member states. We also generally welcome the proposed process for designing a new strategy and an action plan, Preparedness 2.0, to strengthen emergency preparedness, response and resilience in the European region. And in this regard, we would like to make 2 or rather 3 comments. First, the gaps that we have observed on preparedness, on which we all agree that there are gaps, are in our view not only gaps in implementation of IHR and IHR core capacities. In our view, these are also gaps in our understanding of the concept, the notion of preparedness, what it means, and especially as it is defined in the IHR core capacities. For instance, we can no more think about preparedness without including the challenge of misinformation, or even the challenge on global inequities and access to medical countermeasures. Secondly, this new and improved definition of preparedness needs to be translated into concrete and operational proposals for capacities that member states should have in place that for us move beyond the general objectives as we know them in the IHR. And then as a third point, and this is rather a reaction to the comments made by Switzerland, Norway and Germany, we take the point that there should be very good alignment with the processes at global level. Nevertheless, we think that it can be good to start already a reflection at this moment at European level on what we want to see within the process of the INB. So I conclude, therefore, we invite the Secretariat to develop a plan that challenges our thinking through this concept of preparedness 2.0, but also a plan that can help us to find alignments in view of the upcoming INB negotiations, and a plan that is specific and ambitious and that is relevant for all countries independent of their income level. I thank you for your attention.
Merci la Belgique.
Thank you, Belgium. I now give the floor to Spain, who will be followed by Ukraine and the United Kingdom. Spain has the floor.
Dear colleagues, Spain is aligned with the statement made by the Czech Republic on behalf of the European Union and its member states about and supporting the strengthening health emergency preparedness response and resilience, learning the lessons and building back better. Spain supports the proposal of the regional director of the WHO to start a consultation procedure on the creation of a new preparedness and response plan. Spain supports good governance, effective systems, and financial sustainability as key principles of an emerging public health emergency architecture through an all hazards, One Health approach. We are convinced of the importance that emergency preparedness requires a multidisciplinary whole of government, whole of society approach. This entire process and the new plan will serve to translate the lessons learned into a process to increase the region's capacity to respond to health emergencies and disasters with a focus on multidisciplinary whole of government and whole of society preparedness, including member states, community organizations, and other interested parties. Furthermore, we are convinced that the Financial Intermediary Fund will work to ensure adequate and sustained funding for prevention, preparedness, and that enhance the global health architecture and international health regulation, capacity building, and surveillance mechanism. For this reason, we once again agree with the EU declaration, and we believe that any work carried out in terms of preparedness and response must be aligned with the initiatives that are being carried out, avoiding duplication and from a global perspective, but at the same time respond to the challenges that are specific for our region. Thank you.
Merci.
Thank you, Spain. Before I give the floor to Ukraine, I would like to inform you that Czechia has asked for a right to reply. They will be given the floor at the end of the day. So we now give the floor to Ukraine, to be followed by the United Kingdom and Slovenia. Ukraine, you have the floor.
Nous ne vous entendons pas.
We cannot hear you. I think your microphone is not switched on.
As it was stressed by the 75th session of the World Health Assembly, aggression against
Excusez-moi, nous n'avons pas entendu le début de votre intervention. Je vous invite à reprendre depuis le début.
Health of the population of Ukraine, as well as having regional and wider than regional health impacts. The war has already claimed thousands of civilian lives, forced more than 14 million people to flee their homes. Health system of Ukraine has been among the hardest hit. There were more than 500 attacks on healthcare in Ukraine, which left more than 200 people dead and wounded. 826 health facilities have been damaged, and 127 hospitals were reduced to rubble. The war disrupted life-saving health services, including treatment of chronic conditions, and disrupted essential medical supply chains, severely restricting access to medicines. One of our biggest concerns is the impact of war on mental health of at least 16 million Ukrainians who have been exposed to violence and atrocities, displacement, and family separation. As a result of this aggression, millions of Ukrainians have been put on the brink of survival. Vulnerable groups, women, children, elderly, people with disabilities bear the brunt of this health emergency. The risks of infectious disease outbreaks have skyrocketed. However difficult it may be, Ukraine has been doing whatever it can to overcome health-related challenges brought by the aggression. We commend life-saving assistance provided by the World Health Organization Regional Office, as well as the work done to mitigate the pressure the war placed on the health systems of all European region countries. We commend all countries who have provided their assistance, no matter of its nature or volume. The timely response has been possible due to generous support from donor community, EU member states, US, UK, Canada, Japan, and many others. However, the only way to stop the suffering of the Ukrainian people is for Russia to stop its aggressive war and withdraw its troops from the territory of Ukraine in its internationally recognized borders. Of serious concern is the situation of hundreds of thousands of Ukrainians deported by aggressor state to its territory in violation of international humanitarian law. We call on the international humanitarian organizations to get unhindered access to those people, to monitor their health conditions, and to ensure that their basic health needs are met. Another immediate concern is the restricted access of Ukrainians in the temporarily occupied territories to medical care. We cannot allow their suffering to go unnoticed and call on international humanitarian organizations to do whatever possible to provide them with life-saving assistance. We also demand from Russia to release unconditionally members of the Ukrainian medical personnel captured by its invading troops. In conclusion, I would like to thank once again Regional Office and our international partners for their valuable help. The most important lesson from health emergency in Ukraine includes the fact that it is indeed possible to create effective forms of cooperation and work as one to support the country during the emergency of war. We look forward to working closely with all of you as we are setting out on the path to recovery and the rebuilding of our health system. Thank you.
Merci, l'Ukraine.
Thank you, Ukraine. I now give the floor to the UK, to be followed by Slovenia. UK, you have the floor.
Thank you, Chair. Before my main intervention, I just want to be really clear on one point. Raising the impact of Russia's aggression against Ukraine is not politicising this forum. As we've just heard, it's speaking the truth about the devastating health emergency which has been created in our region. The UK fully supports taking a coordinated pan-European approach to emergency preparedness, recognising the important points that have been made about avoiding duplication. We are particularly supportive of the proposal to operationalise the pan-European network on disease control. We look forward to the opportunity to work with Euro and Member States through the proposed steering group, which will play a critical role in the network's development. We welcome the prioritisation of One Health and of antimicrobial resistance, and we remain committed to the global discussions to improve our preparedness and response to potential pandemics, including investment in surveillance. Our work to strengthen our response to future health emergencies comes alongside the multiple health emergencies we are responding to now. Our region has been significantly affected by the most recent active public health emergency of international concern, monkeypox. In the UK, we're using the core tools of community engagement, case finding and contact tracing and vaccination to disrupt transmission and suppress the virus. Clinical trials of therapeutic treatments are underway, and genomic sequencing of cases is increasing our understanding of the outbreak. Elimination of monkeypox within our region will take time, as we've heard, and this further underlines the importance of a coordinated regional approach. Leading into the autumn and winter, the UK is maintaining resilience in its health system through continued public health advice and messaging, contingency planning and targeted testing to protect the most vulnerable. Pharmaceutical interventions, particularly vaccination for COVID-19 and influenza, remain our first line of defence. Vaccination also forms an important pillar of the UK's response to the recent emergence of vaccine-derived polio virus type 2. Vaccination uptake against polio is already high in the UK due to our well-established routine childhood immunisation programmes, but we are offering boosters and catch-up doses to children in the affected areas to ensure everyone is protected. So in summary, the UK, including our new Health Security Agency, welcomes the opportunity to share our experience, to reflect on the future of health emergency preparedness, response and resilience, and to learn from other member states here today. And we look forward to working together with you. Thank you.
Merci la Grande-Bretagne. Je passe à présent
Thank you, UK. I now give the floor to Slovenia, to be followed by Montenegro. Slovenia, you have the floor.
Thank you, Chair. Slovenia aligns itself with the statement made by Czech Republic on behalf of the EU. Excellencies, the last 2 years and a half have shown us how unprepared we were in dealing effectively with major disease outbreaks. We have a duty to learn from that experience and work together to strengthen our health emergency preparedness, response, and resilience. We have to deal with the current challenges first. Still, we are not safe from COVID-19, and we thank the Secretariat who have prepared guidance on how to deal with the virus in autumn when we expect an increase of cases. Furthermore, we must keep a watchful eye on the other two public health emergencies of international concern, the monkeypox and polio virus. Chair, Slovenia fully supports the development of the new legal instrument against pandemics. We are heartened to see that the INB has chosen Article 19 of the WHO Constitution as a default option, as this will allow for a complement of legally binding and non-binding articles, both of which will be necessary to achieve meaningful results. We strongly believe in the success of this instrument. However, we are concerned by the attacks of certain groups on the legitimacy of it and indeed of the WHO. These groups are undermining the global health architecture and must be addressed. Nevertheless, we are encouraged also by other developments in strengthening the global health governance in times of emergencies. The roles of Secretariat and governing bodies should be made clear and transparent to prevent any delay in response. We believe that the new Standing Committee for Health Emergency Prevention, Preparedness and Response will be an important instrument that will allow the Member States to react quickly in times of health and humanitarian crisis, an element that was missing in the early days of the COVID-19 pandemic. We also believe that we must address the problem at the root cause. This is why we fully support the development of the roadmap proposed by the Secretariat to further strengthen the organization's work on antimicrobial resistance through the One Health approach. Thank you.
Merci la Slovénie. Je passe à présent la parole au
Thank you very much,
Monténégro.
Slovenia. I'll give the floor to Montenegro now.
Thank you. COVID pandemic has exposed overlooked weaknesses in the world's surveillance and response capacities. Our world is still very vulnerable. During the pandemic, we faced many challenges, including difficulties to access and roll out vaccines hesitancy, massive misinformation, tsunami, and many other difficulties in managing second and third wave. But we have not been alone. We want to thank WHO Director Dr. Klug and his team for continued support in strengthening our capacity to provide an effective response and save lives our citizens. Being unprepared is equally dangerous at letting the cycle of panic and neglect move on. It is time to take bold action and break this cycle. Making smart investments in health security is an imperative. It can enhance the collective response to ongoing emergencies and strengthen public health systems to reduce the chance of future public health emergencies and health crises. Montenegro is supportive of WHO proposal to go ahead with the consultative process aimed at developing a new strategies to strengthen health emergency preparedness, response and resilience in the WHO European region. The COVID pandemic demonstrated the power of partnership and collaboration. We believe that only with a pan-European roadmap for emergency preparedness, coordinated efforts to strengthen collectivity, health security, we can be curbed. As our friend Dr. Kluge said, crisis anywhere is crisis everywhere. There is no safe Europe Union without safe Western Balkan. Montenegro commends WHO's commitment to managing a participatory, consultative process to discuss practice lessons and research gaps in pandemic preparedness and emergency health response revealed during the COVID pandemic and other public health emergencies, and how these could be effectively addressed to prevent future health crises and amid the vulnerabilities of our region. The new strategic framework should promote multidisciplinary, multi-sector and multi-actor approach, along with a shift from a specific reactional paradigm to a systematic and preventive preparedness paradigm based on the holistic view of people's health. Finally, in the future strategic framework, we would like to see a robust measurement and evaluation arrangement as a foundation upon which we can build accountability and improve overall health system resilience. Thank you.
Merci, le Monténégro.
Thank you very much, Montenegro. So now I'm turning to the Russian Federation. Do you wish to have a right of reply, or did you want to retake the floor on this particular debate item? Yes, thank you very much. We wanted the right to reply on a number of delegation statements, if we may.
Merci, la Fédération de Russie.
Yes, thank you very much, Russian Federation. I would therefore invite you to exercise your right of reply at the end of the day, today. So thank you, ladies and gentlemen. Are there member states who still wish to take the floor on this agenda item?
Je n'en vois pas.
I don't see any requests. So now I will turn to international partners. First, let us give the floor to the Organization for Turkic States.
Honorable Chair, esteemed delegates, Organization of Turkic States, being a comprehensive and effective regional cooperation platform for its members, Azerbaijan, Kazakhstan, Kyrgyzstan, Turkey, and Uzbekistan, as well as for the observer states, Hungary and Turkmenistan, has been heavily invested jointly fight against COVID-19 since the beginning of this pandemic, and deepened the cooperation among its member states and observer states. We were the first international organization to hold a summit on COVID-19 pandemic at the level of heads of state on the global scale. During the summit, heads of state expressed their commitment to the implementation of the requirements and recommendations of the World Health Organization, who supported the central role of World Health Organization in fight against this pandemic. On 11 September 2020, we have signed a memorandum of understanding with World Health Organization, which established the legal basis of our engagement. On the basis of this MOU, Organization of Turkic States and World Health Organization Eurocenter on Emergency Preparedness in Istanbul have been discussing the ways to operationalize this Memorandum of Understanding for the benefit of the OTS member states. An action plan is on the way as well. On the basis of strengthening global health security, COVID-19 response, recovery, vaccination, vaccination disinformation, health workforce development, and health systems resiliency for improving the practice of preparedness for the future crisis have been the key areas. OTS and WHO Center in Istanbul collaborated to raise awareness as to the importance of health system resiliency, healthcare workforce development as two essential elements of health security as part of the European Public Health Week. This was delivered together with UNFPA, Regional Office for Europe and Central Asia, University of Athens, and the Ministry of Health of the Republic of Turkey. OTS is looking forward to deepening its cooperation through implementing the CDMO with the key milestone to strengthen collaboration for improving health and well-being as well as health security for our member and observer states.
I would like to invite you to conclude,
As a
please.
topical example, OTS, together with the Ministry of Health of Turkey and WHO Istanbul Center, are developing three-phase project called Strengthening Emergency Medical Care System in the member of Organization of Turkic States. Another example is OTS collaborated as well with the Ministry of Health of Turkey to organize training program to strengthen the laboratory system. So,
Unfortunately, sir, I must
I
request
could
that you
continue
conclude.
to give more examples, but lastly, I would like to say Organization of Turkic States supports WHO Euro in the development of a new strategy to strengthen health emergency, preparedness and response and resilience in the region, and is ready to actively participate in the regional consultation process.
Thank you very much.
Thank you very much.
Unfortunately,
Thank you.
Merci.
Thank you.
Je vois que le
I can see that
souhaite prendre la
Kyrgyzstan
parole.
would like to take the floor. Kyrgyzstan?
Да, уважаемый президент,
Distinguished President, colleagues, just a few words, if I may, just a few words, comments, if I may, on this issue.
уважаемые коллеги,
Distinguished
пандемия,
colleagues, the
безусловно,
pandemic
обнажила
has
все
unquestionably, of course,
мировой системы
woken the
здравоохранения, и можно
international health
сделать
system,
несколько выводов.
and we can draw a few conclusions
Очень
from
мне
this.
понравилось, как сказал
I
наш
really
президент,
appreciated
что
how one of the other
достаточно
representatives
где-то
mentioned the
пролететь
fact
бабочке,
that
где-то в другом месте планеты может вызвать шторм. И для
that every
инфекции,
country
пандемии,
experiences things differently.
как оказалось, нет границ.
And it would seem that the pandemic doesn't know borders. It is a borderless issue. And of course, it can impact any country. That's the first point I'd like to make. And the second point that I would like to make is, as we're sitting here peacefully in this auditorium, we of course understand that no mask is going to save any person, right? There's some people sitting in masks, but I do hope that this is understood, that it's not any type of real protection, right? It doesn't protect against a global pandemic. It's not a panacea. We need to work on global immunity, rather. We need to have high-quality vaccination campaigns. We need to respect the rules of hygiene, of epidemiological control, and as we've spoken many times, we need to live healthy lifestyles. These are the only guarantors, truly, of well-being and health for our populations. And then thirdly, investments, as we discussed this morning, help well-being and development. They are the key to improving today's systems, and therefore focus must be placed on guidelines for our system where the human-centered approach and the human being is at the very center, not countries. Perhaps a fourth conclusion to draw here would be the fact that we think about the results which we achieved through COVID-19 are probably only thanks to our scientists, right? And the work that they did on NCDs, non-communicable diseases first, cardiovascular diseases first, and other issues, right? And that will probably need to be the focus in the future of our scientists. Now, we are discussing at the current time the strategy for the situation, and I think the strategy being led by Hans Kluge, when it was adopted on the 11th of September, we saw that it applied wonderfully to the situation in Central Asia. I thank you very much for your attention.
Merci beaucoup, le Kyrgyzstan.
Thank you very much, Kyrgyzstan.
Nous continuons avec l'AIEA.
Allow us to continue
vous
with
appeler à vous en tenir aux 2 minutes.
IAEA. Allow me to just remind you that you have 2 minutes. International partners, you have 2 minutes. IAEA, please.
Merci, Madame la Présidente.
Thank you very much, Madam.
Je vais continuer en anglais.
I will continue in English, if I may.
Ministers, dear Chair, dear delegates, the International Atomic Energy Agency, IAEA, has a unique mandate to accelerate and enlarge the contribution of nuclear science and technology to sustainable development, including health, and to support member states in their efforts to achieve the Sustainable Development Goals. It helps countries access technologies that make a key contribution to quality healthcare and supports its member states in strengthening capacities related to prevention, diagnosis, treatment of a wide range of diseases. It aims to help strengthen country health systems by ensuring integration, for instance, of radiotherapy with national health and cancer control policies and programs. To accelerate the achievement of our goals, we collaborate closely with organizations like the World Health Organization. Cancer, for instance, in Europe and Central Asia is also a public health priority. It is one of the pillars of our collaboration with the World Health Organization, and evidence has shown how cancer care in particular, has suffered setbacks as a result of the pandemic. Which brings me back to the topic of this session, Madam Chair. As has been discussed, the world is increasingly facing significant health challenges at global scale. The IAEA has demonstrated capacity to respond quickly to health emergencies. Since the start of the COVID-19 pandemic, we helped 130 countries and territories by delivering RT-PCR diagnostic kits and related equipment. In this region, in the Euro region, 24 member states received and requested a number of packages. WHO, together with the IAEA, produced a joint COVID-19 technical specifications for imaging devices publication. We did not stop there. We looked ahead and launched the Zoonotic Disease Integrated Action Program, or ZODIAC, to support member states' capacities to be prepared and respond to future outbreaks of zoonotic diseases. We remain a committed partner to WHO in this noble mission to promote
May I invite you to conclude, Madam, please?
Thank you.
Merci beaucoup.
Thank you very much. I shall now give the floor to the World Bank, please. World Bank.
Merci encore.
Thank you.
COVID-19 has highlighted the pressing need for action to build stronger health systems, not only to protect the immediate health of the population, but also because of the central role of health in the economy and well-being of the population. The pandemic has made this evident. Pandemic prevention, preparedness, and response is a top priority for the World Bank. We appreciate our strong partnership with WHO and other partners in strengthening subnational, national, regional, and global capacity to prevent, prepare for, and respond to infectious disease outbreaks. We have stepped up our support to countries in implementation of One Health approaches that aim to reduce the threat of zoonotic diseases and antimicrobial resistance at the human, animal, and ecosystem interfaces. In this region, we are supporting the development of the Central Asia One Health Framework for Action for 2023 and 24, with a focus on regional as well as country-level interventions. At the global level, a new financial intermediary fund, or FIF, for preparedness and response was officially launched by the governing board at the inaugural meeting last week. The World Bank will serve as its trustee of the fund, and WHO has an important role in the operation through secondments to the Secretariat and chairing of the Technical Advisory Panel. The FIF will provide additional gap-filling support. It will improve coordination among partners, incentivize increased country investment, serve as a platform for advocacy, and help sustain much-needed high-level attention on strengthening systems. We look forward to working with WHO and the fifth governing body, civil society organization, and other stakeholders to operationalize the fund in the run-up for its first call for proposals in November.
Merci.
Thank you very much. So I shall now give the floor to the European Committee of the Regions, please.
For over the 25 years, the Committee of the Regions has shared the knowledge of local leaders with European policymakers. Our members, democratically elected mayors, councillors, and presidents, are at the very heart of the implementation process of virtually all EU policies. We know best what works on the ground and what does not. Over the course of the last 2 years, we have painfully learned that health emergency preparedness and response does not work as well as we would have hoped. In our United Europe, we saw closed borders overnight, stopping our cross-border healthcare cooperation. We saw our hospitals overflowing, our doctors collapsing from sheer exhaustion and despair. Suddenly, we all discovered just how dependent we are on foreign suppliers of personal protective equipment, ingredients making up our medicine. We realized how vulnerable our health system really are. We understood that health emergency preparedness and response is a key ingredient of strategic sovereignty. At the European Committee of the Regions, we call for cross-border preparedness and response plans. Diseases do not stop at borders, nor should policy solutions. We need to ditch our national silos and work more with regional partners as well as with European and global institutions. As a regional councillor, I certainly hope that EU member states will come to their senses and ditch their idea to cut the EU fourth health budget for the next year by 25%. We are still not out of the woods for the COVID-19, monkeypox is spreading, polio risks to reappear, and the EU Council proposes to reduce the health budget by almost 200 billion euros. Until March 2020, the WHO Disease X might have sounded a bit like a title of a science fiction novel. Today we know it's not a fantasy. It's what the future holds. We need to prepare for it and as local, regional, national, EU and global level. It is high time to rethink our health architecture to make the future proof. This what is 1 million EU local politicians do and what we will need. We will need your guidance and your advice from the UN, WHO. And thank you for your attention.
Merci.
Thank you very much.
Je passe la parole.
I shall now give the floor to Stop TB.
Yeah, good evening. Continue with the children's table. My name is Lucica Diziu, and this is on behalf of the Stop TB Partnership and the partners and tuberculosis. And my intervention is actually a plea for all of us to learn from mistakes and be smart. We rushed very much on the COVID-19 response, and there were many mistakes done. But as you know, in most of the countries in the region and in the world, the response was constructed a lot on the engagement and the support of the health units, the health staff, facilities, laboratories, tactics and approaches of the TB response. The pulmonologists were in most of the places at the forefront of fighting on the COVID, because TB and COVID are two airborne infections. And the investments in the TB programs proved to be of essential value in addressing COVID due to the similarities in symptoms, diagnosis, contact tracing, and case finding. And that's why we make a call on all of you to ensure that in discussing and planning the pandemic preparedness response, you do not forget, while you focus on the new things coming up, don't forget about TB and the people with TB, especially the most vulnerable, and ensure that investments in addressing the future airborne pandemics can also address TB and other existent diseases. and build the health units with proper infection control measures, laboratories that can be constructed on mobile units that are multiplexing, primary healthcare and community workers that are able to do contact tracing and build the live data system that can cover TB, COVID, and other diseases. We want to point to the fact that as we embrace digital technology, we in the Stop TB Partnership, we are at the forefront of pushing mobile X-rays and artificial intelligence readings that are able to diagnose beyond TB other lung diseases, including cancer, multi-purpose mobile diagnostic units that can also go closer to the people affected by diseases, as well as using the COVID already existing platforms and data for TB as well. Yesterday, the RD said, you and I can change the world together. I am ending by saying, if you guys want, we can end beyond COVID and other airborne pandemic existing diseases such as TB. Thank you.
Merci.
Thank you. I do not see other international partners requesting the floor. Therefore, allow me to move to non-state actors. I shall give the floor to Maria Kever-Schunen, who will speak on behalf of different non-state actors. Go ahead, madam.
Dear President, Regional Director, delegates and colleagues. A year ago, the Pan-European Commission on Health and Sustainable Development published its comprehensive and much-valued report on lessons learned from the COVID-19 pandemic. The update presented here shows that the Member States and WHO have made good progress related to the 4 priorities chosen. Nevertheless, we would like to stress the importance of not losing sight of the bigger picture. In this respect, we would like to draw attention in particular to Objective 2 of the Commission's report, which is to take action at all levels of societies to heal the divisions exacerbated by the pandemic. Quoting the Commission, we must close these gaps now, not just as a matter of fairness, but also to mend fractures in society, reduce polarization, and restore trust in public bodies. In doing so, we must constantly focus on sustainable change for the benefit of all, as set out in the SDGs. To address the root causes of our failures during the pandemic, we need a value-driven approach and courageous decision-making. UFA and the 10 co-signatories of this statement therefore call on European leaders to loudly and clearly say never again. And not to only build back better, but also bolder and broader, tackling the entire range of determinants of health, from the biological to the social, commercial, political, and environmental, including climate change. We must ensure that our efforts to rebuild are fair, inclusive, efficient, and informed by science. We need a strong focus on enhancing resilience and robustness of health systems, including the better integration of public health with medical and social care. Finally, visionary leadership and collaborative effort, including civil society actors, will be indispensable. Only by realizing systemic and sustainable changes can we ensure that we will truly build back better and leave no one behind. Thank you.
Merci. Je passe.
Thank you very much. So I will now give the floor to Ms. Lisa Nikolai-Jack.
Merci, Madame la Présidente.
Thank you very much, Madam.
C'est pas Madame Anne-Lise.
It's not
I was
Madam
asked to stand up,
Anne-Lise.
which I hope it's going to be good to defrost a little bit. I just have the pleasure actually to deliver this statement. It's on behalf of Global CERCAF Federation and on behalf of IFPMA, so International Federation of Pharmaceutical Manufacturers and Associations. So we welcome this opportunity to provide comments which are based on our COVID-19 lessons learned report, which highlights that swift pathogen surveillance and sharing, an enabling innovation ecosystem, and regulatory agility are among the lessons that must be preserved for future ability to fight against unknown diseases. The most important lessons of the above-mentioned report is that we must redouble collective efforts to achieve health equity, while ensuring health systems and delivery infrastructure are strengthened. These learnings have resulted in industry tabling the Berlin Declaration, which proposes to create a collaborative solution to be discussed with the G7 and G20 governments for more equitable rollout of vaccine treatments and diagnostics for future pandemics. In concrete terms, industry commits to setting aside doses specifically for priority populations in low-income countries at the outset of a future pandemic. Madam Chair, as discussions continue on how to strengthen health emergency preparedness, we must bear in mind that any future global health architecture must acknowledge a multi-stakeholder structure, including industry, public agency, multilateral organizations, financial institutions, governments, and philanthropic organizations. This is the only viable solution to managing pandemic crisis. Merci.
Thank you.
Merci. Je passe à présent
Thank you.
la parole au dernier intervenant.
So I shall now give the floor to the last speaker, Mr. Rab van Guy.
Thank you very much. Honorable guests and participants, Public Services International and its European partner, European Federation of Public Service Union, welcome to the document related to the agenda item 6. We would like to make the following comment to the document towards a new strategy and action plan. In relation to lessons learned presented in the strategy, we would like to underline the recommendation made by the Pan-European Commission on Health and Sustainable Development report. The WHO recommendation reinforces our policy where it's noted that particular attention to require to ensure inclusion of children and persons with disability, vulnerable and or elderly. The Pan-European Commission Objective 4 recommended to reassess and strengthen the link between health and social care in the light of experience during the pandemic, with the goal of increasing integration between them. We urge Member States to implement this important recommendation and include in the strategy in 2020 EPSU, along with care recipient organization called establishing a committee on the European Union level to assess the failure of the long-term care system, which include their failure to adequately integrative palliative care services. The future work of WHO following the lesson learned, invest in the health and care infrastructure and workforce should be enlarged to investing in the social care. Furthermore, investing in the workforce should include addressing workforce shortages in the health and care services. The pandemic exacerbated existing staff shortage, work overload, burnout, and third-party violence. The government have the crucial responsibility of securing and delivering the required funding to increase investment in the recruitment and retention of health and professional cares, as well as improve needs-based staffing level. Government urgently needs to prepare measurements to make health and care professional attractive. In the term of progress report, we agree that safeguarding the health and social care budget is a priority and should be protected from austerity measures. We strongly disagree with establishing public and business partnership in increasing investment in the health and prosperous community environment practices and environment. We have learned from the past.
Je vous invite à terminer votre intervention, s'il vous plaît.
Past experience, the business predominantly focus on the profit maximization expense of care recipient and the state. Finally, we underline our position that intellectual property barrier to dealing with the COVID-19, monkeypox and other related diseases should be suspended. Thank you.
Merci beaucoup.
Thank you very much. At this point, I would close the debate. Thank you for all these thoughts and comments. And I now turn to our regional director and the secretary.
Thank you very much, Nora, and thank you, everyone. This was an incredibly rich discussion. So I will maybe focus on the main points, the main principles. So alignment between the regional activities and processes with the global processes is a top priority, and I would like to reassure you that this was always in our mind. As you see, we have regular also coordination with other agencies, and I want to comment in particular here, Pierre and the HERA and Andrea, the ECDC, but also the Director General, Sandra Garina from DG Santé. You saw her commitment, and I want to thank again Sandra for having been with us for 2 days. And tomorrow, Roland and me have a meeting also between the co-chair of the INB and as region director of WHO Euro. So alignment is a given, and we continue to work on that. Number 2, we do have the Monti Commission and a lot of work being done, so detailed proposals will be worked out to submit to the December SERC. Third, The roadmap and a technical advisory group on One Health and AMR actually are underway, and this is also what I heard is being reconfirmed. And as I mentioned yesterday, we do have also at the region level now a quadripartite signed between the region directors of FAO, UNEP, WUA, and WHO Euro in line with the global quadripartite. Fourth, the priority for the region at the same time, I see, is to continue and to scale up support to individual member states. And here I really want to give a lot of recognition and admiration to all the staff of Gerald's team and Gerald himself, because we still are facing a lot of ongoing emergencies. So for sure we need to learn the lessons and we need to be better prepared. But I can assure you that all my staff are literally 24/7, 7 days a week, still busy with current emergencies, including how best we can prepare Ukraine for the winterization. Hence, my next duty travel to Ukraine the week of 10 October. And definitely, we are very committed to avoid, to have no duplication, but would like to focus already on some gaps which are identified. For example, in surveillance at the pan-European level. Finally, it seems to me to come back to the theme of my presentation yesterday, the dual track, that at one hand, to work already on a pan-European alert system, because that's what we saw as a weakness, that every country, EU and non-EU, is to be able to pick up any emergent threat, but then at the same time, the best way to deal with it, if there is a threat, is a strong, resilient health system based on primary health care with a health workforce fit for purpose and a strong scientific evidence base, where I understand from many of you, we have to join efforts to gain back some trust by the public in the science. Thank you, and over to you, Denora.
Merci beaucoup, Hans.
Thank you very much, Hans. I'm very pleased to hear the Secretariat's response and these comments, and I think the importance of preparing response to health emergencies has really been highlighted. I think avoiding any duplication in the process is very important, and that the SCRC could be very useful here. And I think I hope this will be reflected in the report. We do not have a decision or resolution to approve under this agenda item, so I declare this discussion closed. I'd like to thank all participants. So I will now go straight to the rights of reply that have been requested over the course of the day, and I will start by giving the floor to Azerbaijan.
Dear Chair, dear delegates, last night the armed forces of Armenia resorted to large-scale military provocation in the direction of Kalbajar, Lachin, and Dashkasan regions of the undelimited Armenian-Azerbaijani border. The armed forces of Azerbaijan took urgent, adequate measures to immediately suppress such provocations to ensure safety of the military, as well as civilian personnel engaged in the rehabilitation and reconstruction works in the areas of close vicinity. Not a single civilian object was attacked by Azerbaijan. As it was confirmed by Armenian side, there are no victims or wounded among the civilian population. Azerbaijani military targeted only military objects in close vicinity of the undelimited borderline with high accuracy, with the aim of suppressing Armenia's capability to attack Azerbaijan. Since 9 a.m. today, taking into account the requests of foreign partners, an agreement was reached on a ceasefire. The large-scale military provocation that took place on the undelimited state border is not an isolated case, but constitutes an element of the chain of military and political provocations committed by Armenia over the recent days. Thus, in recent days, including after the high-level meeting held in Brussels on August 31, ceasefire have been frequently violated by Armenia in the direction of Kalbajar and Lachin regions of the undelimited state border. As a result, units of Azerbaijani military outposts as well as civilian equipment operating in the area were exposed to fire. Let me inform you that Azerbaijan is not and cannot be interested in military escalation in the region. Azerbaijan currently implements large-scale investment projects allocated 3 billion in areas close to the latest military escalation zone, conducts wide-range post-conflict reconstruction and rehabilitation works. Military confrontation are immediately danger to these projects. First group of internally displaced persons were returned to Agali, Zangilan district, which is close to the latest military tension zone. Construction of Zangilan International Airport in the area close to the undelimited state border with Armenia is about to be finalized. Therefore, the escalation along the border is a threat to the reconstruction works being carried out by Azerbaijan and aims at preventing Azerbaijani internally displaced persons to return to their homes. In conclusion, Armenia, by resorting to large-scale military provocations on the undelimited state border, aims to take advantage of the current tension in international relations, political and military crisis in different regions, with a view to getting a pretext to escape from peace talks. Thank you for your attention.
Merci, l'Azerbaïdjan.
Thank you, Azerbaijan. I now give the floor to Czechia for their right of reply.
Madam Chair, distinguished Regional Director, colleagues, I have...
Est-ce que je peux demander aux collègues en ligne de couper leur micro?
Could we ask our colleagues online to switch off their microphones?
I have the honor to speak on behalf of the European Union and its member states. Let us react on the statement delivered by the representative of Russia. The European Union condemns in the strongest possible terms the attacks by the Russian armed forces against health facilities in Ukraine. These serious violations of international humanitarian law must be stopped immediately. We call once again on Russia to stop attacks on healthcare and to allow the safe evacuation of civilians. Humanitarian corridors have to be created and respected with necessary ceasefire assurances. Free and safe access for those delivering medical and humanitarian assistance must be ensured in line with basic human rights principles and international humanitarian law. At all times, Russia must respect its responsibilities under international humanitarian law. Russia also needs to stop its disinformation campaign. That being said, we are expressing here and now our willingness to move forward with multilateral cooperation on humanitarian and health issues, which includes the work conducted within the Euro region with the Secretariat and its 53 member states. Thank you.
Merci, la Czechie.
Thank you, Czechia. And now to the Russian Federation for their right of reply. Thank you, Chair. I would like to use my right of reply to reply to Ukraine. We reject all the accusations from Ukraine concerning the humanitarian situation in that country. As is known, the Russians started a special military operation to protect the civil population of Ukraine in February. Russia is providing humanitarian support to people in the Donbass region. We are regularly sending convoys with medical equipment and first aid kits. The several million Ukrainian citizens, over 3 million refugees have come from the Donbass region. And the statement that was just made by the European Union, we reject this as well. We do not understand why the European Union is using the right to reply when in our statement we did not accuse anyone of anything. It seems that they simply want to make a further statement covering it under the right to reply. We are against the politicization of this session and the politicization of language and attacks against us from the European Union, which they are already doing for the second day in a row. Thank you.
Merci beaucoup.
Thank you. So we will now close the debate for the day, and I would like to pass on some information. The first point is that the Secretariat will be circulating the adjusted proposals on the resolutions and decisions. So please take a look, check your emails to see when this is available from Willy. The second point is that we are still clarifying how to reply to the Russian Federation's request on the terminology that was mentioned. We will let you know tomorrow how we will proceed. And thirdly, the private session tomorrow will start at 9 a.m. sharp. Because of Rule 11.3, the executive director will be chairing this session, and the public session will probably start at 10:30.